India is the largest or top exporter of generic medicines. But you know what? It is nearly impossible to find a generic medicine in India. Sounds like a joke, right? But this is the harsh reality. Jai Hind everyone, my lecture topic is medical sector in India. According to a report released by Medical Healthcare Security in 2021, India ranks 65 out of 195 countries in healthcare sector. Healthcare sector is one of the largest industry or sector which employs around 4.7 million people, and the annual growth rate is around 22%. Now, what this health sector includes? It includes hospitals, medical equipments, telemedicine, medical tourism. What is telemedicine? Telemedicine is nothing but the treatment of disease through the use of telecommunication. And according to a report of August 2022, there has been 22% increase in the telemedicine after COVID pandemic. There has been around 11% increase in the physical health and 33% increase in the mental health medicines. The telemedicine, the economy is of it is around $3.67 billion, and of the medical tourism is around $6.7 billion. Now, what is medical tourism? Medical tourism is nothing but when a person travels from one country to another just for medical treatment. So these are some of the positive sides of healthcare sector. Now, coming towards the dark reality, we see, according to a report, 23% of the Indian population is not able to get the proper treatment. And why so it is? It is because at the time of independence, only 8% of the private hospitals were involved. But today, the private sector's involvement is 93%. The data shows that around 25,000 hospitals are government based, 43,000 are private based, and 70,000 hospitals are both government collaborated with the private one. So this data shows that 62% of the Indian population is majboor for getting the treatment in private hospitals. You know what? How does it feel like when you go to a hospital and the treatment feels like the doctors are not treating, but it's like a businessman when they give you the bill receipt. The one who has money is going to get the better medical facilities. Around 1,445 patients are per doctor, whereas the report released by WHO says that there should be one doctor per 1,000 patients. So what of 445 patients? Even the condition is very worse in India. The condition says that there is the lack of 18 lakh beds and there is a vacancy of 14 lakh doctors. But we are able to produce only 50,000 doctors per year. And if we consider this data, then it's going to take next 15 years to fill the vacancy. What is the reason behind this poor medical facility? The reason behind is that there are 33% doctors at the village and local levels who are not having the medical degrees proper. Even the allopathic doctors who treat are not having even the basic knowledge of medicines, and the local people, and we trust them and get the medical treatment. The condition is more worse, and coming towards the more dark reality of the scam of pharma industry in India, we see that there are two types of medicines. One is branded and another is the generic medicines. The branded medicines are the one because actually what happens when there is a disease, it takes a longer period of time to find the medicine of that disease, and the company that produces the medicine gets patent, and it gets the patent for 20 years, and it will be selling that company will be selling the medicine to the whole world for 20 years with its own choice of price. But after 20 years, the government is going to decide the price and it lowers down, and several other companies also produces the same medicine with the same formula. So the price is lowered and the medicine is called as generic medicines. But in India, what we see that when you go in the medical shops, you will be getting branded medicines, not the generic medicines. And why so? Because there is the linkage between the companies and the doctors. The doctors recommend only branded medicines and they are not going to prescribe you the generic medicines. So even if you want to have generic medicines, you are not going to find it in the medicals and in the outside when you purchase them. And doesn't the government knows about it? Government knows, but still won't do anything. Because you know what? Government is more interested in increasing the percentage in policies and not implementing it at the ground level. Therefore, we see that government is more interested in enhancing the medical insurance rather than enhancing the government hospitals. Thank you so much.